Now, in the fifth and final section, we will talk about some treatment options available for the viral meningitis, and also we will talk about the prognosis associated with the viral meningitis. Treatment is primarily the treatment is symptomatic. With any viral infections, usually we go for symptomatic treatments. The specific treatment with virus, we can try antiviral drugs, but the viral infections usually take its course and usually gets better once the time is over. So the treatment is mainly the symptomatic treatment. If the patient has fever, we give antipyretics. If the patient has pain, we give analgesics. So fever, so nausea, vomiting, all that is symptomatically treated. So primarily the treatment is the symptomatic treatment. Use of analgesics for pain, pyretics for fever, antiemetics for vomiting, fluid and electrolyte status monitoring. So if we need fluid replacement and if there is electrolyte deficiency, we should do the replacement of fluid and electrolytes. Appropriate empirical therapy is medical follow-up ensured. Hospitalized patient should be hospitalized only if there is encephalitis and parenchymal brain involvement, then we should hospitalize the patient. Herpes simplex virus type 1 or 2 is treated by oral or intravenous acyclovir. Acyclovir is effective against herpes viral infections. Acyclovir, famciclovir or valacyclovir. Total course is for about 7 to 14 days. These antiviral drugs are used. HIV meningitis is highly active antiretroviral therapy for HIV meningitis. No specific therapy for arbovirus. So for arbovirus, which is WNV, there is no specific therapy. For herpes, we give acyclovir for 7 to 14 days. For HIV meningitis, antiretroviral therapy is used. IG or immunoglobulin administration intraventricularly is done through an Ommaya reservoir. Other vaccination is also available for some viruses. Live attenuated varicella-zoster virus vaccine. Related vaccines are Rostavax against herpes zoster shingles, inactivated varicella vaccine for transplant recipient, and those in which live vaccine is contraindicated. So some vaccines are also available for some viral infections like varicella-zoster virus. Prognosis of the meningitis, excellent prognosis. Rare patients complain of persisting headache, mild mental impairment, incoordination, and generalized asthenia. So usually the prognosis is very well. The treatment of the viral meningitis, as with any viral infection, is symptomatic. Some viruses are treated by some good antiviral drug. For HIV, we have antiretroviral therapy also, but mainly it's symptomatic, takes its time. Prognosis is very good, prognosis is excellent, and some patients might complain of they have persisting headache, incoordination, they feel little lost, drowsy, lethargic, and they have generalized asthenia or weakness. Infants and neonates, usually outcome is less certain in infants and neonates. Intellectual impairment can occur as a result of encephalitis. Involvement of brain parenchyma can cause the intellectual impairment. Learning disabilities can also occur in children who can have the meningitis. Hearing loss and other lasting sequel is common in infants and children. So the prognosis is excellent in adults, but in children and in infants and neonates, its prognosis is less likely, less certain what can be the outcome of the disease. So different things, treatments, options we can try. We can try antiviral therapy, but the most effective is the symptomatic treatment and should be treated symptomatically. That conclude our topic, acute viral meningitis, and we talked in detail about the specific viral etiologies, differential diagnosis, clinical manifestations, and also we talked in detail different tests performed on the cerebrospinal fluid, and we talked about polymerase chain reaction that can be helpful, viral cultures that can be performed for the diagnosis, and also we discussed about the treatment options available for the viral meningitis and the prognosis of the viral meningitis. So that concludes our lecture. Thank you for watching sqadia.com.